Uh, Good afternoon, good evening, good early morning, uh, depending on where you are in the world. This is the Unboxing AI weekly webinar series by CARPL.ai. My name is Vidur. I serve as the Chief Executive Officer for CARPL. Thank you so much for joining. Today, I have with me our good friend, collaborator, customer, Dr. Osvaldo Landi Jr. Uh, Osvaldo is somebody, is one of those people who now, is not unique to our world, but we still derive a lot of pleasure by working with such folks. Osvaldo is a radiologist. He trained at the Federal University of Sao Paulo. Post that, did a subspecialty in informatics. In fact, Osvaldo, you were the first informatics resident in Brazil. So pretty cool. Uh, Post that, Osvaldo worked at DASA for 2 years in the innovation team, in the AI team, and most recently he is the head of innovation at FIDI, which is the largest public-private partnership radiology provider in Brazil. Um, Again, to everybody who has joined, thank you so much. It's an honor. This will be put on YouTube later. Also, feel free to ask questions. You can use the Q&A box. You can use the chat box. You can do anything. Message us and ask your questions. Yeah. So we have with us Osvaldo. Thank you so much, Osvaldo, for joining in.
Thank you. Thanks so much, Vidur, for the introduction and also for the invite today. It's a big pleasure. And also, thanks for everyone that's watching us.
No, thank you. Thanks. So, Osvaldo, as I told you before we just started, we do this relatively funny thing on the webinar where we ask all our guests to describe what they do in as if they are describing to a 5-year-old child. And you, by the way, are not just a radiologist, just reminding. So when you tell the 5-year-old child what you do, it has to be what you actually do. So yeah, how would you describe yourself? What you do to a 5-year-old?
Yeah, that's very hard. Even for an adult, it's hard to explain to my family what I do usually on family meetings. I would say that I help healthcare companies to or like hospitals, for example, to solve some of their problems and to take better care of their patients using technology. I think that's
Interesting. So you
quite
help,
it.
yeah.
Is that correct?
I guess, yeah, you help hospitals take better care of patients. I think that is absolutely it. Yes, no, very
Yeah,
well put. Uh, makes makes my job much easier.
yeah.
Makes it sound much easier.
I think many people that's probably watching us would describe their work as the same, right?
That's
I
possibly
think
true. But I guess for a 5-year-old child, that's the amount of dimensionality reduction that you probably have to do.
I
So,
think
so
so.
Osvaldo, I'm curious to know, and we briefly touched on this also, but a lot of the people we work with, we interact with, they always ask us, like, why Brazil, right? Like, we are a company between US and India. Most companies of our nature, the US is the ultimate market, and for most healthcare software companies, if you have to become big, you have to go to the US, right? For us, Brazil is a very key market, and we treasure the relationships and partnerships we have with players such as FIDI. And whenever somebody asks me why Brazil, I say that it has the highest per capita radiologists who program in the world. So,
That's probably true.
but why do you think that is?
Yeah, That's an interesting question. I don't really know. What I can say is that I think that there has been some technology ventures recently in radiology in Brazil. People have gathered around them, and I think that not only radiologists but physicians in Brazil, they are starting to see that they can build a career not only attending to patients, which is also of course very important, but they can build other kinds of career working in the in healthcare companies and also in technology companies. So this health tech um, thing has growing a lot in Brazil, I think.
Interesting. And you personally, do you read scans as well right now, or do you only do informatics and innovation currently?
Yeah, I would love to, but I actually don't have enough time to do that. I have too many jobs already. I can't take on another one.
Awesome, awesome. And Osvaldo, like specifically when it comes to AI in radiology, right? Like as I scroll through the attendees here, most of them are people who are f from the ecosystem. Uh, how do you see this play out, right? 5 years from today, or like how is the status today, globally, right? We'll come to FIDI more specifically, but globally, like, where do you think AI in radiology is today, and where do you think it will be 5 years from today?
Um, I think that there's too many companies focusing on increasing radiology productivity. I don't think there's much more to be done there. Like there's many other kinds of products that try to do the same. So reporting software, I think they are all competing products. What I see, where I see more opportunities is downstream from radiology. So radiology provides a report, so provides information to referring physician. What I'm looking for mostly right now is what else can we provide for our clients? So for hospitals, for referring physicians, that is valuable to them. We may use AI or not, but here we're talking mostly about AI. So what kind of AI that I can incorporate in my practice that will bring benefits to my client down the line? So either bringing more business or improving their job. What so these are the solutions that I'm most interested about personally.
Interesting. So do you think so? This is something, very interesting. Referring physicians using AI, right? Do you see, Osvaldo, a day in the future where, and this is very controversial, right? But I guess that is what we have to unbox. Uh,
Sure.
do you see a future tomorrow where a neurologist is reading a brain MR as well, or maybe even better than a general radiologist with the assistance of AI, right? So, neurologist plus AI is better than a general radiologist without AI. Do you think that is possible, given your experience?
I think there might be a few cases. I don't know if as well. I don't think that like diagnostics performance really in terms of I don't know I'm not thinking in terms of diagnostic performances, but I think that there might be some cases where for example a neurologist is reading an MRI with the help of AI, for example a stroke, where they sometimes they can't wait for a report, they need to act quickly, so they might read the report, the image themselves with the help of AI, start the treatment, and then later on the radiologist can join, bring in their expertise and perform a report or even consult directly with the neurologist.
Interesting. So, But you don't think that the clinical context that the neurologist has, adds a lot to their ability to read the MR or the CT? Like, what is it that a radiologist knows that a neurologist does not?
I think it does add a lot. It's very important to have the clinical context. What I think is that I don't know if there will be like AI that will read MRI fully. So there
Mhm.
are multiple. So if you're looking specific for one question, so I need to have one question answered. So for example, the neurologist might want to know, is there a stroke or not? Or how big is this stroke? Can I recover some of it using thrombolysis? Uh, so those are a few questions that AI can help them to answer. But then there might be other findings, other things that are also relevant to this patient that are not related to stroke. So maybe in that specific situation, this information are not as much so relevant, but I think they keep bring in lots of other information. And also, I think that a radiologist might have another kind of view. So sometimes we know that AI can make mistakes. So radiologists can help. They can bring in the image analysis experience. They might even consult with the neurologist and say, for this situation, you should not be trusting AI for this kind of case. We've seen that it doesn't bring the best results, or no, this case is one that the AI output is really trustworthy. We can go with this information.
And so, apart from neurology, like, do you see any other fields where this might be like more immediate adoption
You mean for the referring physician
for the
using
referring,
AI?
for the referring clinician?
I think that you mean the referring physician as the user, because one of the things that healthcare is really complex, that you have the user, you have the client, and then you have the payer, and then the client usually doesn't pay, and the user usually is not the client. So it's very complex. So for a clinician as the user on image, I think that for now, what I see is mostly for emergency, where you don't have time to wait for reports. You cannot wait for reports. So in these cases, I think that the referring physician can use AI themselves instead of the radiology using AI, and then the referring physician as the client. Did I make myself clear?
Yeah, no, certainly. I think, and that's somewhat along the lines of how you are working with us, right, and Occipit, in that sense. So, can you talk a little bit about that? Like, what is the engagement? Like, how are you using CARPL, and just generally nice things about us?
uh, so yeah, we're working on a project that we're trying to use AI for specifically for chest X-rays. We're also discussing other use cases, but for emergency specifically, um, we've noticed that currently most studies, most X-rays, they do not have reports, and that's because the referring physician, they are not asking for reports, and the reason is that they don't have enough time. So usually a report on emergency, it can take up to 1 hour or sometimes even more to be available. um, so the patient is already waiting on the emergency for a few hours, so let's say 2 to 3 hours, and then you add 1 hour on top of this. This could be too much. So physicians, they request X-ray. They do not request reports because they don't have the time to wait for a report. So, and then also referring physicians, clinicians, they are able to read chest X-rays usually. So the radiologists, they have more experience usually, but the referring physicians should have experience as well, so they are capable of reading X-rays. So providing a diagnostic support to them makes sense, I think, and we are working on a project for this.
So, and so, Osvaldo, when you, so to summarize, what you're saying is that in an emergency scenario, it is better for a, you know, either an emergency physician or a ICU doctor or anyone in that situation to get an AI report immediately that they can use as a assistant, uh, as opposed to waiting for 1 hour or how long it takes to get the radiologist report, right? That's correct, right?
Yes, for some healthcare, for some hospitals,
Situations.
I think that that's true. I know that healthcare is very like one hospital is there's no two hospitals that are exactly the same, so
Yeah.
there might be exceptions there.
Mhm. Got it. So do you do some kind of like training programs or something where you make sure that or do you plan to do training programs where you teach, let's say, the ER doctor how to use the AI, right? Because so we've seen research on this also, right, Osvaldo, that you know uh, humans tend to get biased, right? Automation bias can creep in. Uh, the way to break that is to prime the radiologist, to tell them that okay, this is what the AI is good at, this is what it's not. Do you do those kind of activities as yet, or is it too early, or like what are your thoughts on basically training non-radiologists to use AI most effectively?
Yes, we have initiatives for this for training. It's a challenge because the hospital staff sometimes the staff is not from the hospital. It's like a third party company that's providing services to the hospital. So the staff there is not from the hospital itself, and it's hard for us to train them. So it's a challenge, and then it's also very difficult to have everyone at the same time in the room to pay attention to a presentation. They have other things to do. Uh, so we are trying to figure out ways on how can we spread the message for training and understanding how the AI works. So we're trying different approaches. We're trying a few meetings to explain how the project works, what is the purpose, and also I've done a recording of training that they can send through different message applications to other physicians and try to spread the word. And also I have been in person there trying to meet with the clinical leads and explain to them how it works so they can help also to spread the information.
And what is the general receptiveness?
First, people are impressed. Most people are not expecting something like this. So at first they are impressed. Most of them are curious, want to know more about it. A few of them are a bit skeptical, and I think that because they don't really understand how it works, so they are a bit skeptical and a bit defensive. So we try to show them the real purpose of the project, that we are trying to give them another tool, like an assistant, uh, that usually helps with people that are more defensive about it.
Interesting. And can you talk a little bit, Osvaldo, uh, about the CARPL platform itself, right? Like about using the testing piece and then the deployment. Just generally your experience with CARPL.
Sure. So implementing AI is very it's a lot of work to be done to implement AI. you need to validate, you need to build a workflow, so the deployment, and also you need to think about monitoring this once it once it goes live, you need to monitor it. So most healthcare companies, they are not built for this. They are more efficient on providing healthcare services. They are not built for running AI in production. And CARPL helps a lot with this. So we've been working with CARPL for a few years. We've using the CARPL software to validate AI. It makes validation much faster, much simple. So the software is very helpful. Also for deployment, we can easily integrate with CARPL and then have access to multiple kinds of AI instead of going to each one individually. And then for monitoring as well, we can leverage the tools inside CARPL to help us monitor our projects. But what I usually discuss, and I've heard this from other people as well, is that sorry, I think that right now I see the CARPL team as an extension from our own team. I think that what CARPL has, the most special thing about CARPL is that it's not just hiring a software, it also provides a team of experts that have been working with this for many, many years. They know exactly what they're done, and they come in to help you to successfully land your project, and they'll do whatever it takes to get it done successfully. And I think that's the most interesting part of CARPL. And I've heard this from many other sources as well. I think people are usually having the same experience.
That is extremely sweet and kind of you, Osvaldo. I think if I might put a plug for the team, we do truly believe that working just a little bit harder on this stuff, the downstream effects that it can have on patients is just in fact, this thing up here, while this is a virtual background, but we literally have this all over the place in our office also, that we are dealing with patients. It is not DICOM files, it is actually a person behind it. So and that's what drives us, right? And that it's very heartening to hear positive words of encouragement. I will now quickly take some questions. We have three questions here. The first is, how is Brazil placed in terms of technology adoption, like AI and radiology, versus other South American countries on a scale of 1 to 10? Would it
Well,
be who would be
that's a hard
more?
question.
Also, there would be there are other countries that are more ahead in tech adoption in South America.
Well, I don't know if I can really talk about other countries in South America. I have not had experience with other countries, so I don't know if my opinion is really very accurate. The thing with Brazil specifically is that Brazil is like you're living two countries at the same time. So you have a very well developed country, and then you have an undeveloped country. They overlap. So you can cross the street, and it's like you just crossed a country border. It's completely different. So you're probably going to see hospitals that are on the edge of technology. They are really using the most innovative tools, while other places they don't even have EHR. They're still working completely on paper. So it's a very different environment, I think, depending on where you look. And it's also it's not really geographically geographically defined. Sometimes you have on the same geography, you have very different situations, very different environments in the same city or even the same same
That's very
state.
interesting. It's almost like how we describe India, right?
Mm.
That the same 5 kilometer radius can have an entire spectrum of care services. There's another targeted question, Osvaldo, on Brazil itself, where it says that, also, I don't know why people are scared to share their names. These are all anonymous questions. But Does Brazil have government-paid screening programs for breast, lung, or other types of cancer?
Yes. For the question is for breast and what else?
Breast, lung, or any cancer screening programs in the or any screening program
Yes,
in
for
Brazil?
I think that for breast is the one that is most mature, most developed. There are other ones for prostate, for example. I from last time that I checked, I don't think there is for lung cancer yet. I think that there is the task there's the American task force that they suggest that you have low dose chest CT scans for triaging for lung cancer, but I think that Brazil does not use it. Like they don't have a program. Last time I checked, I might be not updated about this.
Awesome. And then we have one question that says, do you believe that commercially available AI solutions uh, should require additional clinical input to enhance their ability to identify critical findings? So basically, is there an opportunity to add clinical data as inputs to these models?
Yeah, I've seen lots of research coming up recently of multimodal AI, where they take multiple modalities. So they take information from IoT and from the EHR and the image. I think from what I've seen, it looks very promising and it's bringing better better results. If you think logically, we already know that radiologists, when they have access to the clinical information, their diagnostics performance increases a lot, and that's already proven. I think there's multiple research papers on this. It makes completely sense that if you have access to clinical information, that AI would perform better as well. That's what I think.
Yeah, no, I think the time is there. Like there are, like on the webinar last week, we had Kritika from India's biggest hospital, AIMS, and they are working on a model that takes in, clinical input as well. So I think that is the future. Last 2 minutes, Osvaldo, we try to end this, on time so as to respect everybody's time. Last question, and you gave some very interesting thoughts on this. What is your advice to youngsters who are getting started in the domain of radiology and AI? If you were to there, I'm sure there's a lot of people who listen to this or who are listening to this who would be interested in your thoughts on that.
Uh, um, First, I think that AI. I think that there is no coming back from AI, right? I think that humanity will not forget about it, will not put it back inside the box and pretend that it never happened. I can only see this growing more and more. So I am hopeful for careers in AI for healthcare in general, not only radiology. However, I think that currently, for me, it looks like we are since the rise of LLMs and ChatGPT, it looks like we are very overhyped. So every time there is a small update on these models, there are lots of publications about it, and I think that there will be ups and downs on the way. I think that uh, healthcare technology cycles, they happen more slower, they are longer. So and they also overlap. Like we said, there are some places that they don't even use EHR yet. So I don't think that AI will change healthcare overnight. I think this is a very long process, and I think that healthcare has lots of issues. When we look at healthcare challenges, most of the time we are looking at the tip of the iceberg. There are more deeper things that we need to work with, that we need to solve. And I think that AI is a piece of this puzzle. It will certainly help on with these challenges. So I would say uh, stay hungry, but also be patient, and also think more broadly, I think.
I think that is a great way to end this. Stay hungry but stay patient. I
Yeah.
think you can't be foolish in healthcare, it seems. Thank you so
Yes,
much,
I think so.
Osvaldo. Means the world. Thank you to everybody who joined. Join our community on LinkedIn. The links are there in the chat box. And next week, same time. See you guys.